The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Today is Friday, June 24th, and I'm Caroline Daly, a Professional Development Coordinator for the Eastern Shore Regional Office of the Maryland Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for DDA, Michelle Hell, DDA Nurse from the Southern Maryland Regional Office, Patricia Shostoki, Director of Programs, Robert White, Director of Administrative Services, Rhonda Workman, Director of Federal Programs, Carrie Shanti, Office of Change Management. And before I begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. If you look at the panel interface on your right, labeled Audio, you can click either computer or phone to switch for the best option. There are two handouts for this webinar, which can be uploaded from the handout section, or if you're listening by phone, you can request that they be emailed to you. We will be recording the webinar and posting the session on YouTube and the DDA website. And questions can be typed in the questionnaire chat box in the webinar panel, and we will get to those towards the end of the presentation. And now I'd like to introduce Deputy Secretary Bernie Simons. Good afternoon.
Good afternoon, and thank you, Carolyn. And I want to welcome everybody who's joining us for this webinar today. We look forward to providing you with a number of important updates and hearing directly from everybody. And as you know, and I've said multiple times, your feedback is extremely important to us. So we can move on to the next slide, please. So let's start today with our highlights and significant accomplishments that have been made by multiple entities in implementing the LTSSMaryland-DDA Module. You've heard us talk about this in the past. This is an IT platform where the person-centered plan is entered, and then how the providers will bill for DDA services for the people that they provide supports to. Currently, some of our other providers are still on the older PCIS-2 system, and others are obviously transitioning in. And so really important was on June 1, 21 providers successfully transitioned into billing into LTSS. This was a milestone. I mean, you know, we're moving, the providers are moving aggressively into LTSS, and we're hearing a lot of positive feedback about how tremendous it is. And I just want to thank everybody for the partnership in this community. You know, there's been a lot of coordination between the providers, the coordinators of case management services, the DDA regional offices, and it's also been extremely helpful to us to have the guidance in what was learned from the early adopter group and how they've been having discussions with people who are coming in and basically taking a look at what do I do and how do I do, and picking the phone up and calling some of the early adopters and emailing them, etc. So I appreciate the interest that everybody has and how we keep moving, you know, in transitioning into this new system that, you know, as I said before, we obviously had legislation that was passed a few years ago that told us go into fee-for-service, get away from the prospective payment system, and then we knew PCIS-2 was not going to work for us because of the limitations. So the LTSS module that we have, the DDA module within LTSS. LTSS is a Medicaid platform, as you know, and I think everybody's done an excellent job. We've seen a lot of positive metrics as we move forward with the number of people moving in, the percentages of the plans that are ready on a go live date, the billings, etc. So, you know, again, congratulations to everybody. So I want to talk a little bit about the Maryland Inclusive Housing. You know, we had an opportunity this month, back a few weeks ago, to present at the National Association of State DD Directors Mid-Year Conference in Alexandria, Virginia. This is an innovative housing partnership that, you know, we created housing teams and support individuals and, you know, help people if they want to be in supported living and not in traditional ALUs or group homes, how we can do this. And, these outcomes are going to help a lot of people become much more independent. And I want to thank all of the members of the Maryland Inclusive Housing and, their board of directors and, a lot of people who put a lot of hard work into this, and the partnerships that we also have with the Department of Disabilities and the Maryland Housing and Community Development Agency, state agency, et cetera. So there's been a lot of collaboration among state entities, but I want to thank, Tim Weens in particular for his leadership after he retired from Jubilee into moving forward with, and coming out of retirement and basically, championing and becoming the executive director of the Maryland Inclusive Housing. As you see on this slide also, we had an opportunity to visit the Main Street Connect this month on June 6th. We were there and wanted to see what that was looking like around housing and an inclusive apartment building. 25% of the 70 units are set aside for people with disabilities, and the other 75 are for, affordable housing options for people. This is near the Rockville Town Center, and it's next to the metro station, so people have an opportunity to be able to, not worry about transportation issues, et cetera, and hopefully can take advantage of situations like that as maybe there's more areas around the state that are developed. So we did that in the morning. In the afternoon, Secretary Beatty and I and a few of the staff from DDA visited SEEK and wanted to hear about their multiple innovative services that they're doing around workforce and community partnerships and new business practices. And as you know, SEEK was one of the early adopters and has had conversations with other agencies in the state that are getting ready to embrace and move forward with the LTSSMaryland module. So sad news is, it says on the slide, staffing updates. I want to take a moment to recognize Tanya Ferguson, my chief of staff, and wish her a heartfelt farewell. Tanya's been a key member of my administration here in DDA for the last 4 years, and she's moving on. She'll be missed. And, I appreciate everything she's done, the years of service and the contributions she's done to our DDA community, not just while she was at DDA, but, she's been an influence at many different areas that she's worked in throughout the state and throughout the country. So, again, I wish her health and happiness for her and her family in the future. Finally, we communicated last week that under the leadership of Secretary Schrader, the flexibilities for Appendix K will be extended. They were supposed to end June of 6 days from now. And now they're going to be extended through September 30th. And, we understand with the recent COVID impacts and, people need to continue to figure out what we're doing and continue to work. And we also need to figure out how we're going to have a phase unwinding, because sooner or later, some of the feds are not going to say there's no more public health emergency. What are we doing? How are we moving forward? And we can't wait until, it's like Friday and next Monday there's an issue. We need to plan and be very thoughtful and figure out the flexibilities we're doing. And again, I want to thank everybody for all your continued support and everything you're doing. And I just think we've done an outstanding job with everything. And I want to congratulate everybody. And I'm pleased to introduce Michelle Howell from the Southern Region, who's going to provide an update around COVID and the COVID boosters. So thank you. Michelle?
Thank you, Deputy Secretary Simons. It's a pleasure to be with all of you here today. Our participants, families, providers have been diligent in offering opportunities for vaccinations and boosters through education, clinics, and community outreach. The DD community was identified early on as a community at risk, and we were fortunate enough to be included in the first wave of vaccines as they became available in early 2021. We may not be where we were 2 years ago, but we must continue to be vigilant. New variants and outbreak surges continue to manifest right now. As we've learned, viruses mutate and adapt to survive over time. We have seen evidence of this in the past, and as we become aware of new variants and the impact they have on the community. Next slide. First identified in late 2019 and by early 2020, we were referring to this new virus, SARS-CoV-2, as COVID-19. Shortly after that, the Alpha variant, first observed in the UK in November 2020, peaked in the US in 2021. This particular variant was 30 to 50% more contagious than the original and caused more severe illness. Fortunately for us, the variant was susceptible to all vaccines at that time. Alpha was followed by Beta, first identified in South Africa in late 2020, but not widespread here in the US. This variant was known to be 50% more contagious than the original strain and may have caused more severe disease. It's known that this particular variant strain this particular vaccine at the time offered less protection from the Beta variant. After that, Delta was identified in India in 2020 and quickly became the dominant strain. Delta led to surges in cases in the US between the summer and fall of 2021, affecting vaccinated people at that time. The Delta strain caused more severe disease in those who had not been vaccinated. Not long after the surges of Delta, and by late November of 2021, the Omicron strain was identified in Botswana and South Africa. Omicron caused a massive surge of cases in the US by December 2021. Omicron was more transmissible than Delta and any other known variant at the time. Omicron's variants included a twist, mutations to the spike proteins that attach the virus to human cells, which basically meant Omicron had found a way to evade the immune responses developed in those who had previously been infected but unvaccinated. Causes a milder case of the disease for those folks, but it was thought to be less severe at the time. However, we still saw a spike in increased hospitalizations. Vaccines and boosters offer the best protection from severe disease, so please continue to support and promote vaccination and boosters. So right here, what we're looking at is a graph of daily number of new cases, March of 2020 through 2022 of June. The graph follows the trends and surges. If you look closely, for example, there's an increase in cases November 2020 through the early months of 2021. This coincides with the appearance of the Alpha variant that peaked in April of 2021. Notice the drop of cases following early 2021 when vaccines became available. And notice the low wave of the Delta variant, followed by the sharp increase of cases following the appearance of Omicron. Now, there's still corona risk factors. The coronavirus risk factors that we are most aware of is that everyone could respond differently to the virus, but we know that people have certain risks that lead to a higher risk of severe disease. Increased age is one of the top risk factors for severe illness. The older we are, the higher the risk. And those who achieve 85 years or older tend to be at the highest level risk. There are also underlying conditions that could increase anyone's risks for severe disease from coronavirus. Heart conditions, COPD and respiratory conditions, type 2 diabetes, severe obesity, smoking, and cancer. Not to mention environmental factors. These include opportunity for infection and exposure. Think of healthcare workers, large crowds or groups, close quarters, ineffective ventilation, not using or improper use of personal protective equipment when someone is really at risk. Now, we do have 4.6 million Maryland residents fully vaccinated, which is good news. 4.86 million received at least one dose. 2.4 million booster doses have been administered, giving us a total of 11.9 million total doses administered for the state of Maryland. Now, I'm going to have Patricia Sestoke, Director of Program Services, give you an update on COVID and booster numbers that have been reported by our provider community.
Thank you, Michelle. That was some really great information. And it's just to remind us how important of the vaccinations and the boosters are. And I just wanted to report that as of 6/22, we have seen an increase of 61 boosters from June 1st. And then you can see on the slide also, we also increased 676 from our last webinar that we've conducted. So if you look at the slide, the chart to the left, you can see that there is 16,862 participants that received the vaccine. That's 83% of the folks that we support. And then we have, they've been vaccinated, 6,859. So that's 34. So this just tells you exactly where we are with the vaccine and the booster. So really just want to thank all of the providers who have been very vigilant and continue to be very vigilant in reference to the vaccines and the boosters. Also, just as a reminder, and on your slide, you can see still contact your local health departments for any PPE, any supplies that you need, N95s, please contact them. And also, if you just want to learn more about where to get vaccinations, there's a link here and a phone number that you can contact. The next slide, just wanted to share a wonderful opportunity that we have here in Maryland through the Kennedy Krieger Institute. They're offering ongoing COVID-19 vaccine clinics open every Wednesday from noon to 6 at the 1741 Ashland Avenue in Baltimore. The vaccination environment is sensory friendly to accommodate those who are sensitive to noise and light. Professional behavior support staff members and members of the Child Life team are also on site to help calm with the vaccination worries. Spanish and American Sign Language communication and translation is available on site. And so to make an appointment, there's the email on the screen for you to use, and there's also the phone number that you can use with the extension. And Kennedy Krieger asks questions during the scheduling process to better understand any supports that may be needed during the vaccination experience. So please visit their website on the slide for more information and take advantage of this wonderful opportunity that we have. I'm now going to go over a little bit about program services updates in reference to Appendix K, updates for providers, community settings rule, national core indicators, and then the employment data that we collect every year. So just going to give you a quick overview of that. With the support of the Maryland Department of Health, Secretary Administrator, Maryland Department of Disabilities, Secretary Carol Beatty, and members of the DD Coalition, our Appendix K flexibilities scheduled to terminate June 30th have been extended through September. You heard Bernie, our Deputy Secretary, say that. And so this means that individuals and families and providers can continue to use these flexibilities while planning for transition. In partnership of the DD Coalition, we will work to further our phase unwinding plan. So current guidance for these flexibilities has been updated on the DDA website at the link noted here on the slide. And while this extension provides more time to use these flexibilities, we encourage providers the need to ensure that they have the current DDA license and certifications, and all staff meet the required services qualifications, including in having their current required trainings like first aid, CPR, before September 30th. So we just keep encouraging and reminding you guys that this is really critical and important, as you heard our Deputy Secretary talk about our unwinding interfaces. The next section, I just wanted to just share that at the beginning of the webinar, you heard our Deputy Secretary share the great communication and coordination between providers, the coordinators of community services, and the DDA regional offices teams on the LTSSMaryland-DDA Module expansion. This success has been the result of many people working together and learning from each other through readiness, responsiveness, partnership, and future. And I'm going to talk about future planning, but one of the things that I wanted to just say that the readiness of providers have been just phenomenal. Providers are using the toolkit. They're really getting there, asking questions. You know, we're doing our lunch and learns, and the lunch and learns have been so successful. We've had 3 so far. Yesterday was our third one. We had a little over 280 people, 225 seconds. So we've had really good attendance. And then the regional directors' engagement with the transition providers, they really are customizing the level of support based on where the providers are. So they're walking with the providers, walk the walk with them, so they can feel comfortable and understand the whole process of being ready. And provider services team in the organization of the DDA team members into the LTSS workstream has been phenomenal. So that's part of the readiness piece. It's so important. The other big piece I think that has been such good for success is the responsiveness. The regional directors, the regional office weekly engagements with the providers pre, during, and post transition has really, I think, been a catalyst for our wonderful success. The coordination between the DDA and the Medicaid provider services around billing, payment, and exceptions have been exceptional. I think that partnership is stronger today than it has ever been. And I think that's just part of the responsiveness and how critical we see this to be a really good transition for our providers and our participants. And again, the LTSS operations work group, that has been ideal. I think under Robert's leadership and his team really have done a really nice job on the responsiveness. And then you can't go without talking about partnership, the collaboration between the initial pilot agencies, the early adopters, and the transitioning providers have been phenomenal. That partnership had got us into some learning experiences of the things to do, not to do, how to enhance our services. The lunch and learns from the DDA, Medicaid, and providers' experiences as they transition into the LTSS-DDA module has been really phenomenal. The DD Coalition and the Department of Disabilities have been catalysts in that partnership, in that guidance. And then, Deputy Secretary Bernie Salmons and Secretary Schrader really listening to the needs of our community members, our families, and our providers. And can't go without saying the partnership with the early adopters. So those are the keys to success. And so I'm just going to kind of give you a future planning here. Part of the future plan that we want to do is we are so pleased that there continues to be growth interest amongst providers around future transitions into LTSS-Maryland-DDA module. With our provider partners, the supportive peer network, and our partners at MDH, we are using the lessons learned to develop an expansion plan and timeline. So we'll be sharing this with you guys. This plan will ensure for the level of support and responsiveness that we know have made a significant impact on the positive outcomes that I just talked about. If you're interested in transitioning to LTSS Maryland or learning more about these experiences, please contact your regional directors or join one of our upcoming webinars that we have, the Lunch and Learns. Our next Lunch and Learn will be on putting it all together. A look at provider transformation plan, and we're doing this on July 7th at noon. If you're interested, just go into the DDA training calendar and you can register from there on July 7th. The other piece that I wanted to talk to you a little bit about are the community settings rule. The DDA and Medicaid have received several questions regarding the community settings rule in Community Settings Questionnaire, also known as the CSQ. The community settings rule is, as you all know, and those who don't know, I'm just going to give you a little bit overview, is a federal policy that ensures that people in services receive Medicaid home and community-based services in settings that are integrated and that support full access to the greater community. Similar to all other states, the Maryland-DD community has been working on a transition plan for full compliance for a number of years, and we have made steady progress and should be proud of the shared vision. We have until March 17 of 2023 to demonstrate full compliance, and so we're continuing to take a number of steps to support this requirement. And joining me today is Lisa Tolman, who is the Chief of Division of Provider Enrollment and Claims and Compliance for the Office of Long-Term Services Support. And as you know, the Community Pathways Supports and Family Supports waivers are operated by us, by DDA, with oversight from the Office of Long-Term Services and Supports. That's where Lisa comes in and provides services and supports to the individuals with intellectual and developmental disabilities. So those are the things that if we have opportunities for our Q&As, Lisa will help me to respond to some of those questions as well. The next slide really just kind of gives you a little overview. As I mentioned, we're working on for a number of years on the community settings rule. And so this slide just kind of gives you a little overview of what we've done related to the assessment strategies and what we've done. And here it highlights what we used in 2014. We used a National Coordinator Survey. In 2016, we did the non-residential provider assessment and the residential provider assessment for homes. And then in 17, we did validation of provider self-assessments. And in 17, we did site visits. In 2017, from 2017 to present, we are using the Community Settings Questionnaire, and that is a participant assessment that the Cornish Community Services complete every year. And then this year, letters of non-compliance to providers have started going out in June. And so one of the handouts that you have for today's webinar is an actual copy of a Community Settings Questionnaire, because I've heard that some of the providers have not ever seen it. So I want to just make sure you had access to it. Our next slide just talks a little bit about that we're using the Community Settings Questionnaire, and that the CCS completes it, and then is visible in the provider MTSS provider portal. And I know that some of the providers don't know that that you can see that. So at the end of this PowerPoint presentation, after the question section, there is about a 7-step with visuals and screenshots on how you can actually look for a person or a site, whether a Community Settings Questionnaire has been completed, and if you're compliant or non-compliant. So I just wanted to share that. And I wanted to be able to say that, providers began receiving their letters from our Medicaid partner on June 13 of this year, letting them know if a specific site was assessed as not meeting the community settings rule. And today I can say that we have 76% of our providers that are in full compliance, and 24 providers have been identified with some non-compliant sites. So what does that mean? So we have about 2,472 sites, and out of the 2,472 sites, 114 sites are not in compliance. So that's not really bad. So providers, you're doing really awesome. Thank you for the cooperation, the support, and we will continue to work with you. The next slide just gives you a little bit. So, I know that you can't really see this, but I just wanted to put it here just so you can see that we have heard questions about how providers, don't know whether they're in compliance or not. They never seen the Community Settings Questionnaire. So I wanted to put it here. The Community Questionnaire focuses on four major areas: access to the greater community, rights of the participant, privacy, and freedom. That is a handout on this presentation that you have. So if you wanted to draw down the handout, the PowerPoint, and then you get a copy of the Community Settings Questionnaire. Some of the questions that you all know pretty much is under the access to the greater community. It has information about, does the participant have the opportunity to seek employment? Does the participant have control over personal resources? Did the participant choose the residence? And that's under the access. Under rights and participation, for example, I will say, does the participant feel that their rights and privacy and dignity and respect are being met? Can the participant choose who provides their services in the setting? And under privacy, it says, can the participant lock the door? Does the participant have the freedom to decorate? And then under freedom, it has questions like, does the participant have access to food at any time? Can the participant have a visitor at any time? So I just wanted to kind of give you a flavor of what that is. And again, this is all from the perspective of the participant when the CCS meets with them. And so that is, again, Community Settings Rule is based on that person's experience. And so I just wanted to give you a flavor for that. This is just a picture of what you would see when you open up your LTSS provider portal. When you go in and under client information, you look under the section and I'll walk you through whatever your compliance and non-compliance. Again, I'm available. Leslie Stusek available. Lisa is available, and to ask any questions about this. The next slide is just to tell you a little bit about a reminder of when we have to be in compliance. Following the assessment of our settings, we are going to focus on communicating with our providers around the areas of their settings that have been assessed as not meeting the requirements. For those settings that will not be able to meet the federal rules, we are working with those providers on the necessary planning to identify a pathway and a timeline to compliance. We are going to be hosting, Medicaid and DDA will be hosting a webinar in July to provide additional information, as well as give providers an opportunity to ask us questions. And so please stay tuned. We'll be sharing the registration information in the coming days. The other update I wanted to do, this is a reminder, and a strong reminder, and is that our employment data collection is due July 15th. We're on our 8th year of participating on this data collection and analysis. We've been doing this, the Maryland Employment Outcome Information System, and some of you guys have been fantastic. Some of you actually have started it but not completed it. So please make sure that you go in and you complete it by the due date. This really helps us with making some decisions on policy and budget. It also tells us exactly where providers are in their readiness and how we move forward. So please go in there. The other one on here on this slide is the National Core Indicators. That is due June 30th. That's just in a couple of days. And so I just wanted to, if you go to the next slide, I just wanted to remind everyone on here that the Deputy Secretary in Robert White has, in lieu of having to complete that whole, requirement from the Maryland Health General Code annotation about the survey, we've replaced the National Core Indicator Staff Stability Survey for you to complete in lieu of that. So this is due June 30th. And I just want to show you on the next slide where we are. And this is where we don't want to be. We want to be 100%. And we're on June 24th, and we had 43%. Out of 223 providers that we send this to, you can see here, 96 have completed the survey, and we still need to have others who have started it. 69 have started it, 58 were invited, and only 43% have completed. So please go in there and complete this so we can be 100% compliance on this. I know that's the goal we want to reach, so please help us reach that goal. Our next slide is just a save the date. I wanted to just say that this next week, in June 29th, we're having our previous former colleague, Stacy Jones, who now works as the Senior Technical Assistant and Policy Associate for the Institute of Community Inclusion, University of Boston, who is going to be doing a presentation on the big picture. It looks at the employment first movement with the context of the larger where we are in Maryland, and then how do we tie this with redesigning and the efforts of moving forward on employment outcomes for the folks that we support. And then on part 2, we actually invited a provider who is going through transformation and redesign on the 14th, and she will be talking about what they did in their agency to really transform and what the unique, innovative things they did to really not only address the staffing issue, but redesigning and doing a different business model. So just stay tuned. There's a lot of great and innovative things happening in program services. So I am now going to turn this over to the Director of Administrative Services, Robert.
Great, thank you, Patricia, and good afternoon, everyone, and happy Friday. A lot of great updates, Patricia, so thanks for sharing. So as a follow-up to the communication that we sent out a few weeks ago regarding the FY23 rate adjustments, again, I just want to remind folks that effective July 1, the rates will increase by 8%. 4% of that is due to the mandated COLA, and then the other 4% was part of the governor's supplemental budget number 3. And so that means that the state will pumping in an additional $112 million into rates. Those rate increases are effective July 1, and you can find the updated rate files using the hyperlinks that are in the PDF version of this presentation. These rate increases will apply to rates in both PCIS2 as well as LTSS. And just a note for those who are still billing for services in PCIS2, we are diligently working to get the cost detail tool updated, and we'll hopefully get that posted to our website early next week. Okay, all right, we're already on the next slide. So this slide is just meant to announce that, we're very excited about this announcement, obviously, that the contract was awarded for financial management and counseling services. There'll be more information and guidance that will be forthcoming, including a more detailed information around transition and other processes. To ensure a smooth transition, we have hired a dedicated program manager to manage the transition and implementation of the new contract and the statement of work. Her name is Monica Harari. She's not new to MDH, but she's new to this role, and she has a very unique background, that qualifies her for helping with this implementation. We're also very excited about the new scope of work and the contract requirements and the overall impact it will have on our self-direction program. We're confident that this will be a great enhancement. And we want to give special thanks to SDAN, as well as to members of the legislature and to folks who are self-directing their services for their input into this new scope. As many of you know, this has been quite the journey. Next slide. We're equally excited to announce that the state has also contracted with an agency as the Quality Improvement Organization. For the, the acronym for that is QIO. And the goals that we hope to achieve with the implementation of this contract is to improve the quality of care for participants, to protect the integrity of the Medicaid program by ensuring that Medicaid pays for services necessary and that those services are provided in the most appropriate setting, increase the overall participant satisfaction, and assist and facilitate the state with its goals, such as gaining Council on Quality Leadership or CQL accreditation. We are also in the process of hiring a dedicated program manager to oversee the implementation and execution of this contract as well. Next slide. So the state selected Liberty Healthcare Corporation as our new QIO-like entity. And, there are several areas of expertise that they possess, as you can see. Next slide, please. As you can see on this slide. And so, there'll be more information forthcoming regarding the QIO and what that rollout will look like. Initially, Liberty will focus on engagement with the state as well as providers to drive outcomes, providing in-depth understanding of continuous quality improvement in person-centered practices, system integration, and predictive analytics, identifying opportunities for enhancements and producing an implementation plan to put them in place, as well as providing technical assistance to drive quality and not just simply compliance, and providing operational expertise on core quality monitoring and oversight activities. And so I know I went through that rather quickly, but again, more information will be forthcoming regarding both the FMCS contract as well as the QIO contract. And now I'd like to turn it over to Rhonda Workman, who will update the group on federal programs.
Thank you, Robert, and good afternoon, everybody. It's a pleasure to be with you today. And as Robert shared, I'd like to give some updates related to self-direction. The first one, as you've heard today from the Deputy Secretary about the extension of the Appendix K authority. And so in terms of self-direction, that provides some more time to get some of those forms and processes done if you have not already completed them. And again, while this extension does provide more time, we want to make sure that participants with the support of their team, such as the coordinators of community services, support brokers, the fiscal management, service providers, and others are available to help you understand any additional forms that need to be completed, staff onboarding and such, so that we make sure that we continue to provide those services and have no disruption to your providers or billing. Next slide, please. As we all know, DDA self-directed services, reasonable and customary wages and rate standards are updated when there's a cost of living adjustment, changes to available funding, and the rate setting process. And as Robert has mentioned, recently the DDA rates were updated, which go into effect on July 1st. Just as a reminder, the DDA conducted a webinar on May 25th, where we shared specific information and guidance for participants self-directing their services. And the purpose of the webinar that we conducted and the guidance that has been shared and posted on our website is to share that information and options for participants when the reasonable and customary standards or rate increases occur. And it included the options and updates such as increasing staff wages and vendor rates using the budget modification process or the revised PCP process, and also the consideration for future wages or rate changes. As noted in our guidance, pay increases for your staff can be offered at any time during the year. You do not have to wait until there is a rate change or COLA. That would be based on staff performance, your policy, the quality of services that you're getting. And again, you can do that during your annual PCP process, or you could consider during that the staff's annual date of hire or their anniversary. In this slide, we've included links to the webinar and links to the guidance that we provided so that you'll have the opportunity to review that information. And as always, the DDA is available to assist you with any questions. Our self-directed leads on the regional offices are happy to assist you. In addition to Christy Colbert, the DDA self-directed statewide coordinator. Next slide, please. So a couple reminders about person-centered plans. We know person-centered planning supports participants' choice, flexibility, and self-determination. So it's a very important component of our service delivery system. Today, I want to share some really important reminders for us and collectively in the team to support that timely approval of plans and budgets. These reminders are based on common clarification requests of submitted self-directed services person-centered plans that come to the DDA regional office. It is important to work with your team to have that person-centered plan submitted timely. Some of the clarification requests that we want to avoid and make sure that we have information in the plan when it's originally submitted includes the participant agreement form should be submitted with all annual plans. That's a requirement. A family of staff form is needed when a parent, step-parent, or sibling is a staff. It's important to note that the services and units listed in the person-centered plan detailed service authorization section and the services and units listed in the self-directed budget sheet should match and align. The budget sheet can have different rates based on the reasonable and customary standards, but the services and the units should align with that assessed need of services authorized in the person-centered plan. The health risk screening tool is also required for the plans and needs to be completed and submitted. The PCP, or the person-centered plan, should include information to support assessed needs for services and frequencies so that we can quickly review and approve those. And again, the DDA regional office staff are always available to provide assistance, help troubleshoot, and provide clarifications. Next slide, please. And we also wanted to share an upcoming date for our next self-directed service webinar. As Robert shared, we're extremely excited about the new opportunity and scope and supports for the fiscal or financial management and counseling services. So we'll be talking about those services and additional information about information fairs where you can learn and actually meet the new vendors, in addition to some updates to some processes and forms. So thank you for the opportunity. And now I'd like to turn it back over to Bernie to wrap us up.
Okay, so I think I got myself off mute. And so let's just take a look at this slide. And basically, you've got all the contact information of the regions. Continue to reach out to your regional offices, and they can direct you to the right people within the office or answer your questions directly. And they're a valuable team to DDA, and I thank you for the support that you give them. Next slide. So upcoming monthly webinars. I want you to note that there's going to be none for the month of July because we had a conflict due to the rescheduled rate review advisory group. And we want to make sure that people have an opportunity to attend those. You can go in and register, and there's a link that you can share and have your colleagues, families, participants, after registering, get the link and be able to listen and participate. Not really participate, but watch the participation from Jennifer McElhaney and Robert White, along with the 10 folks who are the membership representing individuals, people who are self-directing, providers, etc. So with that, we can get into issues around questions and answers. And again, please stay healthy, and I want to thank everybody for your dedication. So let's open this up to questions.
Thanks, Bernie. Rhonda and I are going to tag team the questions, and I'm going to ask Rhonda the first question to you. Do people in self-direction complete the Community Settings Questionnaire?
That's a great question, Patricia. And so the Community Settings Questionnaire is completed by the coordinators of community services. And so for people in self-direction, they would look to complete that based on the person's home. They live in their own home. And also it would be completed if they're attending a day program.
Thank you, Rhonda. The next question I have for Robert. Robert, regarding the extension of Appendix K, will share add-on hours for community living group home be automatically added in PCIs 2, or do this need to be requested?
Great, thank you, Patricia, for that question. For providers who currently have them available, they will continue into FY23 to coincide with the extension of Appendix K. Having said that, providers will still need to work with their regional offices to access them.
Great, thank you, Robert. Patricia, the next question is for you. The question is, what is happening with START in Maryland? Did the pilot in Central Region ever happen?
Great question. Yes, we actually did the pilot in Central. We have 20 participants that participated. We put together lessons learned, and now we're working on the next steps. Our commitment is to bring START here in Maryland, and we are working with the Deputy Secretary, Dr. Meg DePasquale, and some providers in looking at how do we then make this beyond a pilot. Great question.
Thank you, Patricia. Robert, the next question is, what is the status of the non-competitive ARPA grants?
Thank you, Rhonda. So the Maryland Department of Health has sent out communication regarding non-competitive grants. I believe we also gave an update at a previous webinar regarding that status and the feedback that we received from CMS. And so for the individual or any other agency interested or who may not have received that communication, please send me an email and I will be sure to send you the links to the communication so that I'm not wasting much time here in providing that update. We did have a call with CMS as recently as earlier this week, and we're kind of still unpacking that and working on a future communication as well. But if this is specific to the non-competitive ARPA grants, there's been several updates to that.
Great, thank you, Robert. Patricia mentioned today that we have Lisa Tolan from our Medicaid office, who is our liaison and lead for the community settings rule with us today. And Lisa, we have a question related to the community settings rule. The question is, where can we find the state's final transition plan for community setting rule, which was submitted by DDA after the recent feedback and deadline? So Lisa, can you answer where and it's actually the department's community setting rule and not transition plan, not the DDA's. Can you share where they can find that?
Sure. So the state transition plan was submitted to CMS and they have recently sent it back for comments and some responses. So the original state transition plan and the public comments were placed on the website and we took those down after the expiration date. So we are actively working on the comments from CMS and then we're going to place everything on the website, Maryland State Department website.
Great, thank you, Lisa.
Mm-hmm.
Patricia, the next question is, how is DDA collecting vaccination data for self-directed participants?
Great question. So we're collecting vaccination self-reported through either through the regions and through providers. So if a person is in self-direction and they have been vaccinated, if they can let our regional nurses know, they update the tracker, and that's how we put the information in. So if a self-direction person goes into a provider agency to get their vaccination, they would then report that to us and then we'll update it. If that person doesn't go to any of our providers, but go maybe to CBS, we would want that person to just let us know so that we can update our tracker and put that information in. And the best person to reach to update our tracker, it would be our regional DD nurses that we have in each region. And for self-direction, you have the self-direction leads, and if you can, talk to them and they'll make sure they'll guide you and tell you who to go to next.
Thanks, Patricia. There was a comment shared when talking about the transition of providers to LTSS. It says the coordinators of community services should get a good job as well in transformation. Revising plans for the transformation for coordinators of community services had to do. So a congratulatory good work there, note from one of the commenters. Okay, let's go. The next question. Patricia, can you share how the community settings rule affects participants under self-direction?
That's a great question. I think Rhonda just answered some of that, but we know that people in self-direction live in the community, then they're in their own home. So that's already meeting the settings rule. When a participant attends a rehabilitation program or a employment services program, we consider that a non-residential. And so we still have to ensure that those non-residential settings are also meeting the settings rule. So they would, the CCOs would also complete the non-residential community settings rule questionnaire. And then that's how we would want to make sure that their activities, again, is about those areas: freedom, choice, community integration.
Thank you, Patricia. The next question relates to the staff stability survey, and the question is it mandatory?
That is a great question. If you have not printed out your slide yet, please do so. But if you go to slide 23, and that is very clear, it is actually a requirement that providers submit a wage survey for the Maryland Health General Code annotated 7306.1. And so what the Deputy Secretary has done is he said, you don't have to complete that wage survey. Instead, I need you to complete the NCI staff stability survey. So the answer would be yes. It's a requirement and it must be completed by June 30th.
Thank you, Patricia. Another question for you. Does self-directed participate in the employment data collection you shared today and the National Core Indicator Survey?
So yes to both. If the person is getting employment services through DDA agency or through a volunteer through the agency, those we collect that data twice a year for 2 weeks period. And so those providers report that information. If you are not tied into a provider at all, and you're doing that on your own with maybe a higher staff, then we're not tracking that, and we'll probably need to talk about how do we track those folks. But right now, all the services are tied into either an agency, whether you're in employment, they have career exploration, volunteering, or self-employed.
Great, thank you. Another question for you. This one relates to the support intensity scale assessments, and it notes that this person is seeing an increase of these assessments from Telegen, and is wondering if there was a goal for all of them to do this by a certain date, and also wondering how that information would be used and in what way. How do we use the SIS?
That's a great question. So we use the support intensity scale, which is the SIS, to look at the person's identified assessed needs so that then it matches to supports that the person may need to address health, safety, behavior, communication, anything that they need for support services. So we're using the SIS and the health risk screening tool to help a team identify support services needed. The DDA has where we are completing a SIS on a 5-year cycle. Every 5 years, we do a SIS until we get all our 18,000 plus participants in our system. And if you see an influence of that is because usually May, June, and July is when we get the new transition youth coming in, and people who are coming in new to services get a SIS done. So there's always an influx between May, June, and July for the 600 plus TYs that we get. And so we're doing SIS for the new people into services, and then whoever falls into that 5-year cycle.
Thank you, Patricia. Robert, there's a question here about the QIO, and it's asking, will Liberty Healthcare and the Office of Healthcare Quality be providing surveys to agencies, or is Liberty Healthcare's focus on DDA?
Thank you, Rhonda. So the QIO's focus will be on the agencies with oversight from the DDA.
Thank you, Robert. There was a question for self-direction whether Form 5 is still the form used to modify the budget during the extension. Yes, Form 5 should continue to be used as the Appendix K flexibilities have been extended through the end of September. And I know we are at time, so I'm going to turn it back over to the Deputy Secretary for any additional closing. Thank you.
For any of you talking, you're on mute.
Okay, I'm off mute. You think I'd get this down after a while. Anyway, all right, I want to thank everybody for being on this. There was a lot of information. Hopefully you have an opportunity to go through the the slide deck, and again, have a safe weekend, and thank you for participating in today's webinar. And I want to thank all of the participants today. And we had some people like Michelle Howell from South Region, Lisa Tolan, who works closely with us on the settings rule from Office of Long-Term Supports and Services, and the staff within DDA, and thank Carolyn Bailey for doing this, because it's usually not her, it's usually somebody else. So again, thank you for an outstanding job, everybody. And again, have a safe weekend.